Welcome to TPAcademy's new Impact series, focusing on HMSA's Payment Transformation Program. Our Impact series will go beyond the basics of how this program works and present how you and your practice can be affected by HMSA's PT program. In this lesson, we'll review the logic behind how patient attribution works, and then provide some insight on how you can benefit. If you want more details, or you have questions about any part of this lesson, please contact us either by using the comments box on our TPAcademy webpage or email us at tpacademy@teampraxis.com. Also, HMSA's documentation is found on the HHIN website, as well as the HMSA Provider Resource Center. First, we have to cover how you get paid in this program. There are 4 ways: base PMPM, at-risk PMPM based on engagement measures, performance, also known as quality, and total cost of care savings bonuses. PMPM stands for per member per month, and it's a payment that's calculated using 2013 through 2015 HMSA fee-for-service payments. You're paid a flat rate for each of the 3 lines of business, which of course are Commercial, Quest, and Akamai Advantage. You're paid for each of your patients in these lines of business every month of the year, as long as they are enrolled and attributed to you. This means that one patient at a commercial PMPM rate of $24 will bring in $24 each month. A full year would bring in 24 times 12 months, equaling $288. This might not sound like much, but it is if you're not even required to have an encounter. We'll get to that in our next lesson. Now let's talk about member attribution. First, your patient attribution directly dictates what you get paid. Patients are attributed to you primarily by selecting you as their PCP, either at the time of enrollment or afterward by completing a member attestation form, which is faxed to HMSA while you also update COSEVA. Patients who have not selected a PCP are attributed using the secondary logic based on who is the PCP who has submitted the most claims for them in the last 16 months. If there's a tie between 2 doctors, the patient is attributed to the one who sent the most recent claim. In light of this, here are a few scenarios to consider. First, let's think about why you might want to include unattributed patients in your schedule. If a patient comes in for a visit and they are not attributed to you, they must sign the member attribution form in person. You will fax it to HMSA, then update COSEVA. Make sure you collect their copay or deductible while they're at the practice. This is the only form of reimbursement that you will receive for this visit until they are attributed to you. Once they have attributed, you will begin receiving monthly PMPM payments as you do for your other attributed patients. Team Praxis can help you bring in unattributed patients by sending mail or text messages to encourage these patients to schedule an appointment. Then you and the patient can complete the attribution process while they're in the office. Something else to consider: if you learn that one of your patients is also seeing another PCP, make sure to find out why, so you can avoid the attribution tug-of-war. This can happen when your patient is bouncing between you and another PCP, adding to the uncertainty of whether you'll be paid for seeing the patient. So why the back and forth? It may be a matter of convenience, or perhaps they prefer to come to you, but maybe your busy schedule makes it hard for them to get an appointment. This patient feedback can go a long way to inform you of your patient's needs. Once you know why, then decide whether you can fulfill those needs that they are seeking elsewhere. If not, perhaps you will need to enhance your services, or just stop seeing them. This is where payment transformation is a catalyst for increasing competition among PCPs, rewarding those who provide the most comprehensive care and the best coordination of care. This fact does not necessarily mean that large medical groups have an advantage, however. Each PCP is required to be in a physician organization, so talk to your PO to learn how to maintain your competitiveness by coordinating care within the PO. After all, this is the primary reason your PO exists. PPO and Akamai members are at greatest risk of being lost to other doctors. This is because they are not required to choose a PCP when enrolling, so their attribution is claims-based unless you have them manually attest, which means they complete the attestation form, you fax it to HMSA, and you update COSEVA. Of course, if you are providing sufficient care, you shouldn't have to worry about these patients going elsewhere. You may even decide to have them complete the manual attestation process so that you don't have to worry about losing them to other doctors due to claims data. If they want to keep the flexibility of visiting multiple doctors and are not willing to see you exclusively, you can clarify that this does not mean that they can't go see other doctors. They're merely stating that you are their doctor for routine care and for coordinating specialized care. Then do what you can to provide patient contact and care so that they don't have to be seen by a different PCP. Member attestation always trumps claims data when it comes to patient attribution. This means that if a PPO or Akamai patient has been attributed to you, either from enrolling or from manual attestation, no number of claims submitted by another doctor will change the patient attribution. The other side of this coin is that you will lose patients that attribute themselves to another doctor, even if you have submitted many claims for past visits. Again, this is why you must provide care such that your patients have no reason to go elsewhere. Team Praxis can perform our panel cleanup service, which sets patient status to inactive if there have been no visit or tickets for 16 to 18 months. This leads to a cleaner, more accurate panel. Since you're not being paid for these patients, you'll want to bring them into the practice to get attributed. Team Praxis is positioned to be a leader in helping doctors get ahead of the paradigm shift in HMSA's reimbursement program, so you can better focus on your passion, helping patients feel better. Thank you for joining me as we gained a deeper understanding of patient attribution under HMSA's Payment Transformation Program and shared some insight for how it affects you as a PCP. In our next lesson, we'll cover how patient engagement measures determine the 20% at-risk PMPM payment and compare your reimbursement under fee-for-service with the new PT program.